a very, very valued member of our faculty who happens to understand our speaker and his messages better than anyone. So I can't imagine a better person to provide the introduction to our guest speaker than Swati Narayan. Swati, the floor is yours.
So kind of you, Steve. And it is really such a pleasure today to invite Professor Chaudhry to join us and speak to us. So as an introduction, I thought perhaps I will share that I met him for the very first time 18 years ago when I first went to Dhaka. And I don't think I would forget that because I've met him many times over the years, even after that. And now he has a completely different role that he plays. Currently, he's a professor of population and family health at Columbia University, but we're meeting him today as a visiting scholar at Notre Dame University in Indiana, from where he's joining us. Dr. Chaudhry has worn so many hats, and while I was doing my PhD, he was the vice chair of BRAC, which is often described as one of the largest NGOs in the world in terms of the number of employees. Which spans its work from Kenya to Liberia and Afghanistan to Bangladesh, and epitomizes an NGO that focuses on South-South cooperation. And he's also worked as an acting managing director for the Rockefeller Foundation, and has, interestingly for our department, been the former dean of the James P. Grant School of Public Health at Brock University. Dr. Chaudhry is rather modest, but he has received many prestigious awards and has been profiled in The Lancet, which I would encourage all the students to download and read in 2013 for his contribution to public health. And he's also been a founder of Bangladesh, both two civil society watchdogs, Bangladesh Education Watch and Bangladesh Health Watch, both of which I respect a lot. And we're so glad that his colleagues are also here. Dr. Mushtaq Chaudhry has published nearly 200 articles in national and international journals. But today, of his 6 books, he's here to speak about 50 years of Bangladesh. But before that, the book that I really know him from is the one that he has co-written with Richard Cash, called A Simple Solution, Teaching Millions to Treat Diarrhea at Home, which I've had the students read as a case study based on Atul Gavande's piece, Slow Ideas, in the New Yorker. And they were very impressed by what you'll have done in Bangladesh. So today, the book that he will speak about is 50 Years of Bangladesh, Advances in Health, which has been published by the University Press Limited in Dhaka, and which he has kindly donated to our library. So just going back, I'll just say about the first meeting that I had with Dr. Chaudhry. At that time, as always, shying away from this limelight, he was at the back of the conference room. And that for me always is a mark of a man who has done a lot in his life and devoted his lifetime not to being in the limelight, but doing things for the greater good. So I really hope today you're not too modest, and also tell us about your contributions to public health in Bangladesh. Thank you so, so much today for joining us after 18 years.
It's my turn now.
Absolutely, over to you.
Oh, thank you. Thank you so much, Swati and Stephen. These are very elaborate and very kind introduction. I really appreciate that. Although whatever you have said, I'm not sure whether I really sort of qualified for all that you have said. But as Swati was saying that I met her 18 years ago, and after that we have been in touch quite often. And the last time was in Dhaka just before the pandemic, I think. And at that time she was on a kind of a mission, and she was doing sort of working for her PhD. And Bangladesh was one of the 3 countries she studied. I was really amazed to see how much devotion and dedication she had to the research that she was doing. And she stayed in a remote rural areas in a kind of a hut in a village, and shared with local people, the poor people, their food and their lodging and everything, and try to see what is happening across the borders. So I'm so pleased that her work for PhD is now being published. I think this will be a wonderful addition to our knowledge about South Asia, and hopefully it will also lead to further understanding between the people of in this region. With these viewers, I thank you all for thank you OP Jindal University and the School of Public Health and Human Development for this opportunity to listen to me. What I'm going to do, as Swati was saying, that I'm going to present some of the things that we have included in a recent book, which, as Swati was saying, is titled as 50 Years of Bangladesh, Advances in Health. Let me start sharing the PowerPoint, and then can you see it?
Yes.
Okay. So the book is about Bangladesh, and to some people, Bangladesh is to development what is Paris to fashion, which means that Bangladesh has really become a kind of a byword in the development sector, as Paris is a byword in the fashion world. And this is how Bangladesh is now portrayed, as a kind of a so-called success story in development. But this was not the case when Bangladesh became independent 50 years ago in 1971. And in this respect, I wish to thank our friends in India who have done so much in our liberation war. And the people, particularly those who are in our borders, West Bengal, Assam, Tripura, and Meghalaya, they suffered also a lot along with us in this, and we are really grateful for your support, which made our struggle sort of come to a successful ending. But that, as I said, that was not the case in 1971. The economy was shattered. This infrastructure was almost gone, and there were people in many parts of the world who were sort of doubting the feasibility of a country like Bangladesh. And it is said that even at that time, the Secretary of State of the United States, Henry Kissinger, said that Bangladesh is going to be an international basket case. But 50 years hence, we see that we have proved Dr. Kissinger wrong. We have actually sort of turned around, and Bangladesh is now said to be a basket of innovation. So we are very happy that we have come to this stage. But obviously, this is not the end. We have a long way to go, and what I'm going to do today is really to talk a little bit about the country, and then see what changes that have happened over the years in the country. What are the headlines that we hear about Bangladesh these days? Of course, it is that Bangladesh was one of the countries in the backyard, which has now appeared in the courtyard of South Asia, which means that we are becoming more important in the economy and in the geopolitics of South Asia. The economy has also grown, and we are attaining a developing country status in 2 years' time. And Bangladesh is home to many of the successful NGOs in the world. But despite that, there is a paradox. All these have been done despite some problems and problems of governance, problems of low investment, problems of poverty. And because of that, the Lancet, which published a complete series in 2013 that Swati was sort of referring to, the editors of the Lancet called it a paradox and one of the great mysteries of global health. So that's Bangladesh. I mean, it's a story of ups and downs and so on. Bangladesh is also at the forefront of climate change, as you know. But as I said, that there is no room for complacency. We have the SDG coming up in 6-7 years' time. And then we have the super goal to become a developed country by 2041. So with those sort of ambitions there, the country is moving forward. Now, let's see what some of the people have been saying. Some of the important people in the world have been saying about the development in Bangladesh. According to Amartya Sen, it is important to understand how a country that was extremely poor a few decades ago and is still very poor can make such remarkable accomplishments. This is Professor Amartya Sen. Dr. Ramachandra Guha was the editor of the Telegraph of India. He once wrote that was written off as a basket case, Bangladesh is now spoken of as a basket of innovation. And as I already said, what the Lancet said is that one of the greatest mysteries of global health. Recently, after the election of President Biden in the United States, Nicholas Kristof, who is a famous a columnist in the New York Times, he advised President Biden to look at Bangladesh in order to solve the America's poverty problem, particularly for the children. So these speak of how the outside world is looking at Bangladesh. Life expectancy is one of the major indicator of the wellness, of the well-being of the country, the nation, or the community, whatever the case is. And as you can see here, that we have the history of life expectancy over time since 1960 to until 2020. And as you can see that Bangladesh has improved its life expectancy from a very low in the 40s to now about 73. And two other things here which need mention is that in this race, Bangladesh has already surpassed our neighbors, India and Pakistan, of course. But we still have Sri Lanka on top of us, as you can see, the red line. So although we... Hello?
Yes, we can hear you. Please go ahead.
Okay. So Sri Lanka is there, of course. So which is doing much better than Bangladesh. But what is important here is the gap. In the 60s, the gap between Sri Lanka and Bangladesh was quite wide, about 15 years. But now this gap has actually sort of gone down to about 5 years. The next slide is still on life expectancy, but this is an interesting graph because it shows the gender dimension of life expectancy. Until the 1980s, Bangladesh was one of the few countries, I think there are 3 countries in the world, where women lived a shorter life than men. And Bangladesh was one of it. But fortunately, over time, as we moved into the 90s, this actually changed, and this which is a kind of a shame for which was a shame for us. This has now been corrected, and as you can see here, that women now live about 3 years more than men, which is the more expected distribution for life expectancy. This one shows the experiences with respect to different mortality rates, and as you can see that the bottom ones are mainly the child mortality, child-related mortality, infant mortality, the neonatal mortality, and the under 5 mortality. And all have registered some sort of a reduction over time, but the most impressive one seems to be the black one, which is the maternal mortality, and as you can see, and we'll see later as well, that maternal mortality has actually reduced from over 600 in the 1990s to less than 200 in 2010. So we have seen this big drop in different mortality rates over time. Fertility is another indicator of a nation's demographic status, and here also we see we compare Bangladesh with Pakistan and the state of West Bengal. We have taken West Bengal as a kind of a comparator because that's probably more sort of close to Bangladesh, and is a good comparison. There are similarities in culture, in language, and so on. So what it shows is that the total fertility rate for Bangladesh and Pakistan, we started about the same at 6.6, but compared to Pakistan, Bangladesh has done much better, of course. In 2020, Pakistan had a total fertility rate of 3.6 compared to 2.3 in Bangladesh. But you see that West Bengal has also a total fertility rate which is still lower than Bangladesh. But as you can see in 1975, the base year, for example, the gap between Bangladesh and West Bengal was quite high. But this gap has also gone down significantly over the time between Bangladesh and West Bengal. This one shows the nutritional status over time, and in both terms of the short children, the stunting, and also the underweight, the two important malnutrition indicators. So both have registered decline over the years, but still Bangladesh has about nearly 1/3 of its children are stunted. This is shameful, which for a country like Bangladesh we cannot really accept this. So there are interventions which are trying to sort of change this, but is becoming quite difficult. With respect to the GDP, with respect to the economy, Bangladesh has done well in recent times. As you can see that the Bangladesh GDP per capita is more than its neighbors, but still lower than Sri Lanka. This one shows the comparative growth rates in the economy, of course, between Bangladesh and Pakistan, and as you can see that Bangladesh's growth rate, the bottom line was in the early years was much lower than that of Pakistan, but since the 90s, Bangladesh has actually surpassed that. And the Bangladesh has maintained a consistent growth rate of about 5 to 6% over the last 20 years, which even during the COVID, Bangladesh has maintained a positive growth rate. The other thing that has happened is in the improvement in the gender relationship, and there is one index, which is a kind of a composite index called the Gender Gap Index, which is a interplay of 4 parameters. As you can see here, the economic participation and opportunity, educational attainment, health and survival, and political empowerment. So all these taken together, this sort of index shows the status of a community with respect to gender relationship. And as you can see that here Bangladesh even surpassed that of Sri Lanka, and we are very close to the United Kingdom. Bangladesh has done very well in agriculture, and as you can see that the production of rice has increased exponentially over the years. So over the last few decades, the population has doubled, but the production of rice and other cereals has actually more than tripled, which means that the per capita availability of rice has increased quite a lot, contributing to improved nutrition that we are seeing. Another indicator is the contraceptive prevalence rate, and as you have seen in the slide on total fertility rate, which is related to this, shows that the contraceptive prevalence rate between Bangladesh and Pakistan and also West Bengal. West Bengal continues to be a leader in this, with about 3/4 of these eligible couples using some form of contraceptive, compared to 62% in Bangladesh. But even this 62% one should be sort of happy about, in the sense that Bangladesh is said to be kind of a Muslim country, and of course, when the family planning was introduced in this part of the world, there are a lot of opposition to that, but over time this has been neutralized, and family planning is now part of Bangladesh, part of the people of this country. Compare this with what Pakistan has been lagging much behind with respect to introducing contraception as a way of life. The NGOs have been as I said, that Bangladesh is an NGO country. There are thousands of NGOs in the country. Some of the NGOs are really big, and for example, BRAC is said to be the largest NGO in the world, in terms of two indicators at least. One is the number of staff that it employs, which is more than 50,000 or paid staff, and also the number of people which are reached by the NGO. And in this case for BRAC reaches over 100 million people, mostly in Bangladesh, but also in several other countries as well. But largeness is one kind of thing. The scale is important, of course. But when we are talking about a BRAC, many people raise the question about BRAC is doing well. It has been sustaining on its own, and it has large programs. The question is, so what? Are you being able to really impact on the lives of the people you work? So in the late 90s, there was a large study, very detailed study done in the ICDDRB. ICDDRB is a international research center on health, which has a demographic surveillance system, which they have been maintaining since the early 1960s. And that was the area which made it possible to study the impact of BRAC's microfinance and education program on health. And this graph shows the child survival of the children of members who joined BRAC's microfinance program. And as you can see that the top two lines, one is the survival experience of the member, which is the brown dotted line, and compare this with the survival experience of the richer sections of the village. So through this, the survival status of the BRAC members who are poor has reached almost at this same level as the richer sections of the village. So the inequity that was there in the child survival area, because of the work of BRAC, this has been this inequity has disappeared. But for the bottom line, which is the survival status of the poor people who didn't join BRAC, there is a huge difference between those who joined BRAC and those who didn't join BRAC. So this shows very clearly that the work of the NGOs have also had a big impact on the life of the people they work for. Bangladesh also has a long history of immunization, and Paul Greenough, who is a health historian, who used to work for the University of Iowa, and he has been doing a lot of research on the vaccination programs in the subcontinent, and he studied quite sort of intensively the history in Bengal, and he from his work we sort of know that the word vaccination in Bangla, it is called tika, has been there for the last 200 years, even before the smallpox vaccine was invented by Jenner in 1799. There used to be a large number of people coming from outside Bengal, and they used to call themselves tikadar. They came to Bengal and inoculated the population in Bengal. So Bangladesh has a long history of sort of vaccinating its population. So when the WHO started the expanded program of immunization in 1978 after the Alma-Ata, Bangladesh was one of the signatories, but nothing really happened until the mid 1980s. So at that time, Bangladesh had only 2% coverage of the vaccines, but there was a lot of pressure on the government to improve the UNICEF and WHO and World Bank. They were pushing the government to really take a serious step on that. And the government knew that it was not in a situation to do it themselves. So they invited NGOs to come forward, and together the government and the NGOs have sort of made history in this, and the whole country was divided into three parts. 1/3 was given to BRAC, 1/3 was given to another NGO, CARE, and the rest, the half was maintained by the government. And the NGOs actually worked in social mobilization, creating demand and so on. So within 5 years from them until by 1990, the immunization rate shoot up from 2% to 70%. So that was one of the fastest growth of the vaccination coverage. And importantly, that Bangladesh still maintains this, even though there are lot of problems. And the other thing is that when the immunization vaccination program was started, it was a kind of a vertical program. A lot of attention was given to that, but now it has been integrated with the overall health system, which means that this will probably sustain. And Bangladesh now has one of the highest immunization rate in Asia. So that's another success story of Bangladesh. Even during the COVID crisis, Bangladesh has done quite well in vaccinating its population. Diarrhea, until the 1980s, Bangladesh, diarrhea was one of the major causes of death. And Swati has mentioned about a book which sort of documents the 10-year history of BRAC trying to combat diarrhea, trying to make people aware and let people know how to make oral rehydration therapy at home with home ingredients of salt, sugar, and water. And this 10-year thing was done by BRAC that trained thousands of workers who went from house to house and trained mothers how to prepare this the solution. Afterwards, of course, the government came, and now there are many private sector pharmaceutical companies who are also producing the ORS packets. And because of this serious work that BRAC did in the 1980s, which created the base for ORS in Bangladesh, and now Bangladesh has the highest ORS use rate in the world. About 80% of the diarrhea episodes are given some form of ORT. So this is quite significant in the history of Bangladesh development, and as you can see that the other countries in this region are also catching up. India now has about 50%, and Pakistan is less than 40%. But the overall global average is about 60%. So this was a kind of a major contribution of an NGO at the national level. this one shows the status of open defecation, and open defecation is one of the indicators of sanitation. And as you can see that we have data here until 2015. Bangladesh seems to have almost 0% of its population defecate openly. But that's not the case with many other countries. The situation, of course, for India is said to have changed recently with the Swachh Bharat mission that was initiated by the present government. Bangladesh has also done well in the sanitation sector. But are we sort of doing it to the best possible way? If you look at the health workforce, Bangladesh is one of the countries which the WHO calls the crisis country. Bangladesh is in a crisis with respect to having the adequate number of health workers, the health workforce. So in this table, we see that Bangladesh has the lowest density of health workforce per 10,000 population in this region, 9.9 for Bangladesh and 25.8 for India, and all the other countries have much higher rates. Sri Lanka has 31.8. So when we talk about health workforce, it includes the doctors, the nurses, and the midwives. So in terms of these three, Bangladesh's density of health workers is the lowest. So Bangladesh is working, health system is working, but under so much of constraints. Health expenditure is an important part, and it's one of the main building blocks for health system. And here also Bangladesh is lagging behind. If you look at the per capita health expenditure, Bangladesh is lowest is lower than India or Pakistan. Also, public health expenditure as percentage of total health expenditure, Bangladesh is lowest. And also in terms of the out-of-pocket health expenditure as the percentage of the total health expenditure, Bangladesh has the highest out-of-pocket expenditures. And this is not only in South Asia, but perhaps in the world, that Bangladesh has the highest out-of-pocket expenditure, which has a huge implication for poverty alleviation. We know that about because of the health shocks that happen to many families, many of the families actually slide down to poverty because of health shocks, and their number is said to be 3 to 4 million every year. So that remains a major bane in the way the health system works in Bangladesh. Another problem that we haven't been able to do much about is child marriage, particularly for girls. And as you can see here in this graph, we have the proportion of girls who are married off by age 18, 65% in Bangladesh. So, which means that 65% of the girls are married off by the time they are only 18 years. And 18 years is also the legal age at marriage for girls in this country. And this is the highest in the world, I think, unfortunately. And there has been a lot of concern about this. but we haven't seen much progress in the recent times in really changing this unfortunate situation. Obviously, it's a matter which involves not only the government, but not only the health sector, but also many other sectors, the education sector, the security, for example, safety and security of the girls, and of course the economic status of women. So this is something that Bangladesh has to really think about if they want to really gain the status of a developed nation. Like most other countries, Bangladesh is moving to the NCD age, in the sense that about 65% of the deaths now in Bangladesh is due to NCDs. And there are studies which show that the Bangladesh population has almost every NCD that are sort of indicated here: cardiovascular disease, chronic respiratory diseases, cancer, diabetes, mental and neurological conditions. Almost all the risk factors that cause these are also present in Bangladesh. Fortunately, the use of alcohol is not much in this country. And also that there hasn't been any concrete intervention to address this so far. But the government is talking about this, fortunately. Finally, one of the final slides is about research, and one of the chapters in the book talks about the research situation, the research on health in Bangladesh, and it compared Bangladesh with other countries in the region, and one of the indicators was how many peer-reviewed articles on the COVID-19 was published in 2020, and as you can see here, that unlike the other indicators, of course, India is much ahead of every other country. But here, although in most cases Pakistan was behind Bangladesh in other indicators, but here, as you can see, that Pakistan has actually sort of overtaken Bangladesh in the terms of knowledge generation with respect to the COVID, and one of the important reasons for Bangladesh, why Bangladesh has done well, is the use of research, and there are a few excellent research institutions in the country, like the ICDDRB, BRAC, the Bangabandhu Sheikh Mujib Medical University, and similar others. But obviously we have to really sort of invest more in health research. The government recently has given more attention to it, and allocated more money, but the bureaucratic problems has really made it almost impossible to use those extra money that is available for research. I'm going fast now. So the question is, why is this positive deviance that we are seeing? Why is this paradox? We see that there are many sort of plausible reasons. These are hypothetical, of course. We feel that the liberation war played a very important role, particularly in the way the mindset of the people changed, mindset towards development, mindset towards women's rights, and so on. And there has been improvement, expansion of the health facilities, Now, for example, there are thousands of these community health clinics which have been set up, although there are many problems in there. But those static facilities are there. There has been a large number of public health programs that were implemented at scale, which included things like, as I said, about the ORT program, the immunization program, the family planning program, and so on. Also the water sanitation. Also, the poverty reduction has happened, although we have a long way to go there, and agriculture has the. And the other important thing is the drug policy. In 1982, Bangladesh enacted a drug policy, which was to many a kind of a revolutionary step for that time in the world. And that sort of banned all the unnecessary drugs and made drugs available at a much cheaper rate. And that seems to be one of the reasons why Bangladesh has done well. People can buy them easily. And also that it has contributed to the overall national economy because Bangladesh is almost self-sufficient in drugs, and it also exports drugs to over 100 countries. Bangladesh has been very sort of active in dealing with the natural disasters and the number of deaths that happen through natural disasters has drastically been cut over the years. We have a flourishing private sector, particularly to talk about the ready-made garments. Bangladesh is the second largest producer of ready-made garments in the world after China, and most of the workers who work there, of the 5 billion workers, are women who come from the rural areas, and this also imbibes in them a kind of a new horizon, a new aspiration for a better life. Empowerment of women happens through this and many other activities, particularly of the NGOs. And as I said, that Bangladesh has a huge NGO sector as well. Finally, there is no complacency, as I said earlier. For example, if we compare the maternal mortality, Bangladesh has a maternal mortality of 176, as this one says. But if we compare with our neighbor Sri Lanka, it has 30. So we have a long way to go to reach the level of Sri Lanka, and also we are signatory to the Sustainable Development Goals, and the goal says that you have to reduce maternal mortality to at least to 70, but it seems almost an impossible task. So we have to really work hard to reach the SDGs and other goals that we have set for ourselves. Finally, what are the challenges that towards the SDGs and the smart Bangladesh that we want to build by 2041? Of course, there are emerging issues, NCDs, the urban program, the urbanization, road traffic accident, malnutrition, and so on. We also have, I've spoken about the poverty and also the out-of-pocket expenses. Also, the other thing which I haven't talked much about is the investment in health. Bangladesh spends the least in health, but less than 1% of the GDP is spent on health. This is the lowest in the world, except for South Sudan, I think. There are problems of governance, the absenteeism of doctors and other health workers. Corruption is endemic, as you all know. And we have a large and expanding private sector, which is largely unregulated. And so, and because of this, there are problems of even more Caesarean sections that are happening in the country. And of course, there is rising inequalities. um, the index for inequality is the Gini index, and if you look at the change, the index has actually risen over the last few years, and so the kind of a panacea, if I can call it, for all these woes is universal health coverage. And Bangladesh is a signatory to that, but we have a long way to go to achieve universal health coverage, and that's where we should really give our attention to how we can go to a situation where everybody, every citizen, has access to good quality healthcare with affordable sort of price. So that's universal health coverage, and we must work to sort of attain that. So that's what I wanted to share, some of the sort of snippets from the book that Swati mentioned, and these stories have been recorded, have been documented in many sort of publications. One is the Lancet series of 2013. The one in the right is the Bangla version of the 50 years of Bangladesh. And the middle one is what we have been talking about. So with this, I think I have taken a long time. I'm sorry for that, but this is what I wanted to share with you, about the book and the contents in the book. By the way, the book is available on Amazon, both as ebook and as well as hard copies. So with these few words, I thank Jindal for giving me this opportunity. Jindal is a very respected name in education now. It's said to be the best private university in India, and I congratulate Jindal for attaining that status, and I'm sure it will move on, and it will be nice to see how Bangladesh, and particularly the Bangladesh, the BRAC University can work with Jindal over the years. Thank you very much.
Thank you so much, Dr. Chaudhary. Steve?
Very warm thank you to you. That was wonderful. And the reference to the fact that we want that collaboration between our institutions would be welcomed in the future did not fall on deaf ears. I think it's perhaps the opportunity now to hear from some questions or comments from our audience, and I'll turn it over again to the competent hands of Swati to field these questions and manage the rest of the session. Warmest thanks, though, on our behalf. Splendid.
Thank you. My pleasure.
Swati?
Thank you so much, Steve and Dr. Chaudhary. So we'll just put it as a democratic platform now with all our faces, and anybody who wants to raise a question, and Sambudha Chaudhary has already raised his. So wonderful. Please just unmute and ask the question to Dr. Chaudhary. The two Chaudharys.
Yes, and I mean, I have to begin with, with saying that, how talking about Bangladesh can't be, separated from, the emotional connect that, I as ethnic Bengali have. My grandparents from my father's side, they grew up in Bikrampur, Dhaka. So, these are things that, one can't but, marvel at that and take some pride, perhaps a little unfairly, as, Bengalis living on the other side of the border, but most certainly that. And, there was a time when we only saw Bangladesh as, places where cyclones happened and people got displaced, and now we talk about Bangladesh as this. So as you mentioned, so it's just so I'm going to tone down from that excitement and joy, and especially to have you speak about things, some known, some new. I have a question which you alluded to in your reference, that the government and the nonprofit, the NGOs coming together, particularly for the vaccination program. What do we see, across the world? There is a gradual erosion of the welfare state, if you can call it that. If in the third world we ever had a proper welfare state, and nonprofits, coming into that space. Of course, nonprofits offer agility, innovation, all the things that we want. But at the same time, a gradual recession of the government from providing services of welfare and health and education and other things. So for Bangladesh, it started its journey with the involvement of nonprofits in a way in the 80s that was not very common at that time, especially in the global south. So how do you see going forward, what this equation will be, and how much, especially with the increasing liberalization and increasing privatization of certain parts of healthcare, how do you see this interaction going, and how much will the government, what will be the negotiations like with a nonprofit sector, which has done fantastically, but there are still issues of, who drives the agenda. Like, there are certain donor-driven agendas which we talk about. Of course, Bangladesh has very successfully negotiated that, but going forward, and especially in a climate of increased privatization of services, how do you see that? And now, because the Bangladeshi government has more revenues to spare, so do you see any changes in the way it asserts itself and negotiates in this space?
Thank you. I mean, like your ancestors who came from Bikrampur, my family also came from India. Actually, I was born in Kolkata. So we do have a lot of connections still. And I whenever I get some time, I go to Kolkata, spend time there. But coming back to your question about the NGO and the government, we have seen that in the case of Bangladesh, for the first 2 decades, for example, the government was obviously weaker than what it is now. And they knew that they wouldn't be able to implement national programs. So they invited NGOs to come, and then the NGOs were also sort of happy to do that. And also the donors were there as well to support NGOs to accomplish that. And that led to many of the great work that was done there. But this still, I must say that this hasn't really stopped yet, because some of the major programs are now implemented by both the NGOs and government together. So, for example, the TB program, tuberculosis, this is probably the only instance in the world where an entire national program has been handed over to NGOs to implement, and what so Bangladesh gets money from the Global Fund, and in that both the government and BRAC are the principal recipient of that money, and they together implement this program. The implementation is done by NGOs, not only by BRAC, but also sort of with other NGOs, and government provides the drugs. They provide the overseeing of that. Similarly, it happens with malaria program and so on. But as you said correctly, that we are seeing a change in that relationship within Bangladesh. The government seems to be less interested to involve the NGOs now, as you have seen during the COVID crisis, that NGOs were not much involved. That's because the government itself was they thought that they can do it themselves, and that the donor money was not available for NGOs because of the COVID, the Brexit, and later the Ukraine war. So what we are seeing is what we call a kind of a love and hate relationship between the NGOs and government. The relationship is at its best when the government thinks that they need NGOs. So at the time of disaster, a cyclone or a flood, they need NGOs to really implement programs. But in others where the government has less commitment, we haven't seen much collaboration or interest on the part of the government to work together. Thank you.
Thank you.
Thank you. That was so comprehensive. Any other questions? Can you all please raise your hands? Yes, Diksha.
So we had this assignment where we were discussing and researching on the out-of-the-pocket expenditures in different countries, neighboring countries of India. And there was this report which says that Bangladesh has one of the highest rates of out-of-the-pocket spending on healthcare in the world. So what are the impacts of this high out-of-the-pocket spending on healthcare access and financial protection in Bangladesh?
Very good question. And this is being sort of discussed and debated almost every day in Bangladesh, this out-of-pocket thing. And as you said very correctly, that we have 67% now, which is probably the highest in the world. And the immediate impact of this is that people don't use health services if they have to spend money, and they go to the nearest sort of pharmacy or to a village doctor to treat. So the real treatment is affected. So that's one kind of health related problems that sort of implication for that. The other is the poverty implication, because as I said in my presentation, that because of the health shocks, every year about 3 to 4 million people slide into poverty. And if we have an accident, for example, which requires a long stay in a hospital, the family spends everything they have. They sort of sell their assets and so on, and through that they become even poorer and poorer. So it has a huge poverty implication, this out-of-pocket, and one of the important and effective ways is to make sure that you have a kind of a at least pseudo welfare state through providing ensuring universal health coverage for everybody.
Thank you, sir.
Any other questions? Does anyone have any other questions? I would like, in the meantime, before anyone else does, during COVID, we saw that Bangladesh, actually, in India, we had the oxygen crisis, and we also had a migrant crisis. But Bangladesh increased its GDP during the COVID months. So can you just give us an idea of what Bangladesh did differently from India, or did well?
I'm not sure whether they did it well, but certainly a little differently. is that we did have kind of a shutdown, for example, for a prolonged period, but that didn't last long, and the economy was put open. The industries ran. The government's workers, for example, they returned to their work. And the economy kept on going, and so that's one thing. The second thing is that the government also sort of announced different kinds of incentive for the different sectors, and that was about 3% of the GDP, which is a huge sort of investment or sort of help to the economy and so on, and also the government provided food and cash to the poor people in the village. So those are some of the things, I think, and it remains still a kind of a mystery why Bangladesh, and for that matter, India too, certainly, and Pakistan, of course, why the pandemic affected these countries less than other countries. So this is something that needs to be further studied. I think further research is needed on what led to this. When COVID struck, the people are really worried that what will happen to the slums. But to our pleasant surprise, we saw that I mean, it was not at all a problem in the slums. So there was a what you call the reverse equity there that the richer sections are affected more than the poorest section. So those kind of things happened and may have contributed to what you have seen there. There were shortages of course, oxygen and the PPEs and so on. And some of the civil society groups, they were very active in really bringing those issues to the fore. For example, the Bangladesh Health Watch, they did studies, and for the first time they said that many of the doctors don't have the PPEs, and although the government initially didn't like us for saying that, even the Director General phoned me and said that you shouldn't have said this publicly, but we thought that this is our responsibility as a citizen. And after that, the government became more active in looking after the health workers.
Thank you. I don't think we have any other questions right now, and you'd also said that you need to leave at 8 o'clock. So will I hand it over now to Steve? We can't hear you, Steve.
Steve is muted.
Yes, no, I'm fine now. We have about 10 minutes before you have to leave, but we're already 20 minutes, I think, over our scheduled time. I would love for this conversation to continue. I'm sure there are many other questions, and I'm looking around to see if there's not a last-minute effort by one of the students to raise a hand and come up with something that you'd like to ask. I just want to make sure we don't overlook anybody who might be a little bit intimidated, but I'm encouraging you to overcome that and share a question. There is one that I would like to add to what you've already said. If you could say a few words about the current state of Bangladesh's interactions with global partners in the area of overcoming these hardships, these difficulties that you enumerated toward the end in public health? Who are your good partners? Obviously, you work with WHO. Obviously, you work with Gavi. But what are the strengths that would be useful for our students to be aware of too, to know what are the global partners that can be truly valuable to a country like Bangladesh?
Good question, Steve. Of course, as you mentioned, that we work closely with the traditional health institutions such as the WHO. We also work very closely with UNICEF and also, of course, the World Bank, which is quite influential in the way the health system is done here. So those are also the bilateral governments. For example, the FCDO, which is the UK aid, for example, and also the USAID. They are also major supporter of health programs in this country. So these are mostly for implementing government programs. You mentioned about Gavi and also the Global Fund. So those are there. But also we have seen support from several foundations, such as the Gates Foundation or the Rockefeller Foundation, which have been supporting mostly research. Also, the British Wellcome Foundation is a major partner here. So apart from the bilaterals and the multilaterals, these foundations have been sort of providing some important support to particularly the research things that happen here.
Well, thank you very much. And that also gives our students, I'm sure, an opportunity to get a better understanding of what are the potential employers or locations for internships and that sort of thing, because you now hear how valuable this collaboration is for overcoming the obstacles to Bangladesh continuing to be the positive deviance that it has been, and what it would like to be to achieve its 2041 very ambitious goal. I think this opportunity to hear you speak and to essentially launch your book with our audience, and I would encourage all of our students to not only read the copy that's in our library, but access the copy that you can get online and through Amazon. This is, I think, an exemplary effort to explore both the positive and negative aspects, to draw lessons for the true value of public health policy and how to overcome the obstacles, but at the same time, how to understand great accomplishments. And of course, we admire what has been accomplished. And I launch out to our students and all those listening that overcoming the obstacles to maintaining that trajectory of improving health is a shared goal that we all have. And I think this is, I hope, the first of many opportunities to interact with you, to involve you with our students. We certainly hope that you will come to campus. We certainly hope that we can find other collaborations. And saying that, I do see that Nandita is here. I wouldn't want to leave without giving you a chance, Nandita, if you have any thoughts, or Nitesh, if you have any thoughts about how this might be kind of the beginning of something valuable for us as a School of Public Health and Human Development.
I don't have any questions, but I just wanted to say that, I mean, obviously it's a remarkable sort of a story of how, the trajectory that Bangladesh has seen. A lot of lessons for us, I think in India, we often look towards the West for lessons, and we forget that within South Asia, there are a lot of examples of doing things right. I also want to say that I think the story of Bangladesh, and I'm sure the book might also reflect on it, also shows the importance of partnerships. I think the reason perhaps, I think perhaps one of the reasons why Bangladesh has seen this sort of success, and also this, so many academics writing about it, is because of the solid foundations of trust between partners. And I have to share that I personally have a little bit of a connection with you, which is obviously like many degrees of separation, but Richard Cash was one of my mentors at grad school, and I had the pleasure of TAing his class a couple of times. So it's obviously, so that is the connection. But for us, I think we're a new school. And I also feel like for us, there's a lot to learn in terms of how to set up these partnerships. We are located in India, but we don't necessarily think of ourselves just as an Indian university. And to be able to collaborate, cross-nationally, and a lot to learn. So I really hope that perhaps Steve, we can, move forward in setting up more of a South Asia coalition. And thinking about how to take this relationship forward, because there's much learning for our students also from the context of Bangladesh, and possibly in the future for students from Bangladesh here with us. So there's a lot to learn. So thank you for spending this your morning and our evening with us, and yes, wonderful to meet you.
Thank you very much, Nandita. This brings to a close this extremely successful event. I want to especially thank Swati for having taken the initiative and having seen this through and having guided us. It's been a spectacularly, from my point of view, successful event, and for all the reasons that Nandita mentioned and that our other colleagues have mentioned. So once again, thank you very much. If there are any more administrative matters or anything else you want to say before we close the session, Swati, or can we declare the session closed with warm thanks and warm greetings, and see you next time, everybody. Thank you again for your attendance.
Just a quick comment before we leave. Thank you, Dr. Chaudhary. It was so wonderful to hear the whole story. It looks like, we have to really look back and introspect why, being with so similarity between India and Bangladesh, we have been only looking at West. I think that would have been a perfect example, and Nandita has summarized in a better way that we have to look for partnership and see how much we can learn and reset our goals with looking at what Bangladesh has done wonderfully in last decade. Thank you so much for sharing the story. We look forward to meet you sometime and working together. Thank you so much.
Thanks a lot. Okay, thank you,
Very
everybody.
much. Thank you.
I have a quick question.
Oh, one
I have
more
a quick question, Dr.
quick question.
So
from-
this is where can we get the Bangla version of the book that you shared, the one by Bangladesh Watch, Bangladesh Health Watch? Is that available on Amazon?
It's not available on Amazon, but I can try to send you a copy.
That would be lovely.
By mail. I'm asking my colleague here, Alam Shak, to if you send the address to which it should be sent, so we'll be very happy to send it.
Yeah, it'll be lovely. I can read it in Bengali. Yeah.
Sure.
Okay, with that, thank you again, and best to everybody. Good day and good evening and good night.
Thank you. Thank you so
Thank you.
much. Thanks.
You too. You too.
Thank you, everyone. Thank you, professors.
Bye-bye.